Okay, on this video we're going to show you how to check to see if your band is holding pressure. I've got a band on my arm. First thing is I have all the air out of the band, and when I have it strapped on snug, the skin moves with it. Next thing we're going to do is we're going to pump it up to the recommended pressure on the band, and that pressure is 200, okay? Now, very quickly, if you put the valve back on, it's going to lose pressure from taking it off and putting it back on. I'm already down about 160. I unhook it and hook it back in. A little pressure is lost each time. Now I'm down to 140. So if you're checking your band by putting the valve back on, just realize that the bands are going to drop anywhere from 25 to 50 every time you do that. Now, when I'm working out, I typically pump my bands to about 250. Now when I'm working out, realize the size of my arm is going to change because of the backup of blood into my arm. And as I get 15 to 20 minutes in my workout and I go to check it again, it's always going to be lower. When I work out at 250, when I get done, my band is typically around 150. That is normal. Now, if you suspect that the band is losing air, we're going to show you 3 different tests to do. First test we're going to do is we're going to hook it up and we're going to pump it up to 400, and we're going to let it sit on the counter for about 2 to 3 minutes, and we're going to pay attention to the needle. Now I'm going to fast forward this and just assume that we've been sitting here 2 minutes. You can see that that needle's not moving. The band is holding air. Okay, so that's test number 1. Make sure sitting on the table that the band is holding air. Here's test number 2. Unhook it and leave it on the counter for 15 minutes. And then come back and check it. If it is actively leaking, it is going to be down well below 100. So when I come back and check it, remember, I took it off and I hook it back in. I'm probably going to have lost anywhere from 25 to 75 pounds of pressure. You can see now I'm down to 350. Take it off, check it again. Now I'm down to 300. What we're looking to see if it's really leaking is I sit it out on the counter, it's 400. I come back 15 minutes later, you'll notice most of the air is gone, and it's probably going to be down around 150 or maybe even 125. That's an indication that we have a leak. After you've done test 1, looking at the needle to see if it's actively moving. Test 2, leave it on the counter for 15 minutes. If you then believe it is leaking, we're going to go to test 3, which is the underwater test. We're going to test a band now underwater. I've got the band pumped up to 400 and I'm going to submerge it. Now you're going to notice a small amount of bubbles coming out because there's air trapped in the Velcro between the layers. So if you see just little bubbles coming out, then that's normal. But now we're looking for an active leak. I'm going to start down here at this end of the band. I'm going to push on each individual bladder, okay? Each one as I've worked my way up towards the valve, and I've got no active leaks. Again, those couple little bubbles, that's not a leak. If we've got a leak, you're going to see bubbles pouring out either around the valve. You can see here I pushed, and those initial bubbles are no longer pushing. I've got a well-functioning band. Let's show you what a leak does look like. I've got this band underwater, and you can see that. You want to zoom in on that, Noah? That's a leak. You can see those bubbles are pouring out very fast. This band's actually leaking where it hooks into the band. So that's what a leak will look like if you've got a leaking band, and this is how you test it underwater.